This is the Charrette's protocol for supination of the foot. The first adjustment we're going to do is the navicular and the cuneiform. I'm going to be at the side of the patient, and I'm going to interlock my fingers, putting my superior aspect of the hypothenar on the navicular and cuneiform. I'm going to come down, I'm going to find the navicular, I'm going to interlock my fingers, I'm going to have my arms akimbo, I'm going to take my superior elbow an inch lateral, and then I'm going to traction, slightly dorsiflex, and then my thrust is going to be superior to inferior, and the direction of correction for the navicular is medial and inferior, and for the cuneiforms it is inferior. After that, we're going to do the cuboid. I'm going to take my medial hand, bring it down the shin until I find the lateral superior aspect of the cuboid. Then I'm going to brace it with my outside hand, bring it to the side of the table. I'm going to bury it in between my knees. I'm going to bring tension, and then the line of drive is going to be superior to inferior by straightening my knees. And the line of drive for the cuboid is inferior medial, or the line of correction. After that, we're going to do the met heads. I'm going to be at the foot of the patient, and my thumbs are going to be pressing superior to inferior on the second, third, and fourth metatarsals, while my hands are pulling the first and fifth metatarsals inferior to superior. After that, I'm going to bring the patient's foot up for the talus. I'm going to bring my lateral hand down the shin until my pinky locks on the dome of the talus, and then I'm going to brace it with my medial hand. I'm going to bring my elbows in, and I'm going to bring tension, and with the scooping pull, I'm going to bring my elbow straight back. And then next, with the calcaneus, I'm going to brace the calcaneus with my medial hand, and with my thumb on top, I'm going to mobilize the calcaneus, doing clockwise, counterclockwise, and figure 8 motions. And then the last one is the fibular head. I'm going to bring the patient's knee up. I'm going to find the fibular head. I'm going to take a tissue pull anterior to posterior, and then I'm going to go lateral to medial to bury my second knuckle all the way behind the fibular head. I'm going to bring the patient's foot up, bring her leg to tension, and then my thrust is going to bring her foot towards her butt, and that's pushing the direction of correction of the fibular head P to A.